This is Dr. Manjunath Khan. Welcome to my YouTube channel again. Let's learn medicine together and in a very simplest possible way. Today I am doing case-based discussion. Here's a patient, 7-year-old female child who was brought by mother with complaints of fever since 4 days, red color rash over body since 3 days, abdominal pain since 3 to 4 days. The fever was high grade, child was toxic looking. Rash was red in color, started first in neck, then to involve trunk, extremities as well as face. And abdominal examination was not significant, no organomegaly. So here is an image showing characteristic of the rash, which was erythematous and was having fine papillar eruptions. Here you can make a papillar eruption, and rash was spreading from neck to downwards, that is cephalocaudal direction, and rash was blanchable on examination, and these are fine papillar eruption like a goose pimple. So what's your diagnosis on this by the history and characteristic of the rash? So this is a scarlet fever, which is a second day rash. So we need to know which are the rashes, on which day they come. The mnemonic for the day of rashes is very sick patient must take double treatment. So day 1 is varicella, day 2 scarlet fever, day 3 is pox, that is smallpox, day 4 is measles, day 5 typhus, day 6 dengue, day 7 is typhoid. Let's learn scarlet fever. Introduction. It's a re-emerging bacterial infection caused by group A streptococcus that result in pharyngitis associated with characteristic red sandpaper like rash. You have to remember word sandpaper like rash and fever. Epidemiology. Organism causing scarlet fever is group A streptococcus, which is gram positive cocci arranged in chains. This image shows gram positive cocci in chains, and the root is it spreads by droplet, respiratory droplet. Toxin involved is pyrogenic exotoxin, which is also known as erythrotoxogenic toxin, and toxins are ACSSA. Alone or in a combination, they can cause a scarlatiform fever. Rash and the sickness is due to these toxins. Age group usually 5 to 15 years, and the season is winter and early spring. Okay, this is to show chain like arrangement. This image shows timeline of scarlet fever. The scarlet fever is caused by gas organism, that is group A streptococcus with respiratory droplets. Incubation period is about 2 to 5 days, and on the second day of fever, rash starts. Rash which is erythematous with fine papillar eruption and which is blanchable, and rash spreads on day 2 to day 4 from cephalocaudal direction, and rash starts fading within 7 days, and that also from cephalocaudal direction, and rash also discommit, and it gives rise to sunburn appearance. Okay, the rash initially starts at neck, okay, then spreads downwards, and if you notice here there is a pallor around the mouth, as rash is seen around on the cheek but circumoral area is spared. And there is a strawberry tongue, initially due to coating, which is white strawberry tongue, and later it becomes red strawberry tongue when the coating discommation. And there is a also called as sandpaper rash, which blanches on paper pressure. There is a special entity called as Pastia lines. This is accentuation of rash in creases. So this is the comparison of sandpaper and rash, which are looking same. And the rash feels like a goose pimple, feels rough on touching. Okay, this is also same goose pimple appearance. There is a special entity called as Pastia lines, which is accentuation of rash in skin creases such as cubital fossa, axilla, groin, neck, which appears as red colored linear streaks. If you notice here in the cubital fossa, there are red colored linear streaks here. One more is here, and one more is here. They are not visible clearly, but they are there in our patient. Strawberry tongue, not a pathognomic sign, can also be seen in other condition. Initially, tongue is coated papilla are swollen, which gives white strawberry appearance. Once a desquamatation starts, reddened papillae are prominent, giving a tongue red appearance, which is called as red strawberry tongue. This is the image showing white strawberry in initial days, and later it becomes red strawberry 2 to 3 days later. So here in our patient, child came to us on the 4th 5th day of illness, so already desquamatation has started. So this both white posteriorly and red strawberry tongue is seen. Okay, if you notice here, there is a circumoral pallor, as rash mainly involves cheek and spares perioral area. Diagnosis: with classical sandpaper like rash, fever, strawberry tongue, diagnosis can be made clinically. To support diagnosis, we can send blood ASO titer, which suggests recent group A streptococcal infection. Where else we will send a ASO titer? In acute rheumatic fever, post-streptococcal glomerulonephritis, as these are also caused by group A streptococcus. Throat swab for rapid antigen testing. PCR culture can also be sent. Rapid antigen testing is very rapid report and easy to perform. So we can send PCR, which is sensitive as well as specific. Culture will take time, but need to send to confirm the diagnosis. Treatment: antibiotic therapy for patient with gasopharyngitis can prevent acute rheumatic fever, PSGN, shorten clinical course, reduce transmission of the infection, and prevent suppurative complication. So it is recommended to start antibiotics. The first line, you need to remember what is the first line antibiotic and duration of the treatment. The first line antibiotic is penicillin or amoxicillin for 10 days. If allergic to penicillin, start cephalosporin. Third generation cephalosporin are prepared. Other condition associated with strawberry tongue: Kawasaki disease and toxic shock syndrome. So we need to see the difference between Kawasaki disease and scarlet fever, as Kawasaki disease is the closest differential diagnosis of scarlet fever. Kawasaki is caused by immune mediated illness, wherein scarlet fever is caused by gas organism. Age group is 5 to 15 year, here it is less than 5 year. The fever is high grade and it responds to antibiotic. And fever is persistent and it does not respond to antibiotic. If you don't treat the child of scarlet fever, child will eventually improve. But if you don't treat Kawasaki disease, child will worsen over a time. You need to treat in time, you need to act in Kawasaki disease. The rash is like a sandpaper, wherein Kawasaki disease, it is polymorphous rash. Pharyngitis is present in scarlet fever. It is uncommon in Kawasaki disease. Cervical lymphadenopathy is bilateral and tender in scarlet fever. Cervical lymphadenopathy is unilateral, non-tender. Usually palms and soles are spared, but palms and soles are also involved in Kawasaki disease. Conjunctivitis is absent in scarlet fever and it is present in Kawasaki disease, which is non-purulent. Cardiac involvement is rare. Cardiac involvement is common. Coronary artery aneurysm, myocarditis can occur. Treatment